Hello, I'm Dr. Milescu, and I'm assistant professor at Daytona State College, and we are doing part 2 of our cat dissection. And today my goal is to take out the organs from this cat. It apparently is a female cat. And so let's begin. We started it last week where we did a ventral sagittal incision. And now I've dissected a little bit further so you can see all the organs. So last week we took out the heart and we examined this tiny little heart. Okay. And we actually cut it in sagittal cut, as you can see here. And we went over it last week, so I'm not going to do that again. Basically, I wanted to go over the thoracic cavity, which includes the right pleural and left pleural cavity, which holds the lungs. So as you can see right here, don't know if you can see them, Mr. Cat here, but these are the lungs. All right, so I'm gonna take these out now for examination. Right lung right here, left lung right there. So let's take these out. All right. So using my 10 blade and scalpel, I'm going to dissect out the lungs. And after I take out the lungs, I'm going to show you the diaphragm. Okay, there's the left lung. Okay, I'm going to turn the cat this way so you can see me take out the right lung. So there's the lobe. Trying to take it out without removing the inferior vena cava incoming to the heart. Okay, and here you can see the left lung. I'm sorry, the right lung. There you go. Okay. Okay, so now what we're looking at is what's left, the mediastinum. So in here, you're going to find all the structures, the inferior vena cava, the aorta, and you could see it's dyed in red and blue. So red is the aorta and the inferior vena cava. All right, so now the next thing I want to show you is the actual trachea. So I'm going to take that out. Let's see. And you're going to love to see this because pictures are fine, but when you see the cadaveric cat and you'll see the tracheal rings, it's pretty phenomenal. So I might just leave it in situ and not completely take it out, but I just want to take the connective tissue off the fascia so you can really see me isolate it. It's a really tough tissue. And then what I'm going to do is, after showing you, I will dissect it out just so you could see its strength. And I already cut through part of it, so that'll be easy. Okay, there we go. This is really nice. Very nice. So, there's the trachea. I'm going to come as close as possible so you can see the tracheal rings. See that? And I already cut inside so you can see it feels cartilaginous. There it is. Tracheal rings, trachea. Okay, So I'm going to cut it out. And you can see it goes right to the pharynx back here. Constrictor muscles, trachea. See the circular rings? Okay. All right, let's see what else I can find for you. Next I want to show you the diaphragm. There's your diaphragm right over the liver. See that beautiful dome-shaped structure? So guess what? I'm going to take it out. Let me get in the right position here. And guess what I found? Piercing through, I want to show you, is the inferior vena cava. So there's the inferior vena cava, dyed in blue, piercing through part of this, what's left of the diaphragm. Pretty amazing. I'm going to cut these out with a scissor. So this shows you how, there's the inferior vena cava. See, it's blue, dyed in blue, piercing through the diaphragm. Okay, we're clearing up this body. See? And now we're going to take out the liver. That should be easy. And we're going to find the gallbladder right underneath, which I will take together. Here we go. Along with it, I'm going to find the hepatic artery, which is pretty phenomenal. Okay, and if you remember that image in your PowerPoint, here's the liver, and there's all your ducts. Here, there's your inferior vena cava. So there's the lobes. Look at that, inferior vena cava right here. So I'm going to put a probe through it so you can see. There it is, inferior vena cava. How cool is that? All right, let me identify the gallbladder, which is right here. That's your little gallbladder, right there. All right. And let's see what else we can dissect out. I'm going to take out the greater omentum and lesser omentum. And I should be able to find, yep, I found it. I found the pancreas. So I'm taking out the lesser omentum. So if you look here, separating out the lesser omentum. And retroperitoneal. Voila, is the pancreas. I'm going to show you how it is exactly behind the stomach. Retroperitoneal. So here's the stomach right there behind it. Let me pull it back. And this tissue that we see, there's my pickup there, right there. Okay. Right there, there's your pancreas right here. Retroperitoneal, right there, all of this. This is just fat. But right there, along there, if you can see it, that's your pancreas. Okay, I'm going to pull it out, and that should be easier to identify. Let me put the liver aside for now. Here I go. I'm going to dissect out the stomach and the pancreas together. I think I'll just use a blade. It's faster. All right, so let me take out what's left of the pancreas. It kind of crumbled up on the way out, but this is pancreatic tissue. So what I'm going to do is dissect it out around the fat so you can see it better. Pancreatic tissue. You see what it looks like. Pancreatic tissue. Okay, now let's take out the stomach. And the stomach is, as you know, the first part of the small intestine. You can see here the duodenum. So there's your J-shaped pouch. Duodenum or duodenum, there's your first part of the small intestine. Duodenum, and then jejunum, and then ileum. So I am going to cut the stomach with the first part of the small intestine out. I may get some poop. Let's see. All right, I'm gonna keep it. There's the lumen of the small intestine right here where my finger is. Luckily, there's no poop. Did not squeeze it, not gonna try. There's your stomach, duodenum. Oh, there it goes. Now it's leaking. All right. That was the stomach and duodenum or duodenum. Okay, now what's left is a little bit left of the diaphragm. So I'm going to dissect the diaphragm out, as you can see. And a little bit of the liver is left here as well. So I'll take it out with the remainder of the diaphragm. And then we're gonna talk about the rest of the small intestine and get to the urinary tract, since that's what we're doing next week. That's the rest of the liver. More liver, because it takes up half the body there. All right. Well, I got a good view of the esophagus, so I'm gonna dissect that out for you. Okay, so I'm pulling out literally the esophagus, and I did a cross cut so you can see the esophagus. Very, very strong muscular tube. There's the remainder of the diaphragm. And quite posterior, you can see here, dyed in red, you can see the aorta. All right, now, very good view of the inferior vena cava here, because I cut a portion of it out along with the liver. There it is. I don't know if you can see that, but there it is. Okay, and now I'm going to take out the jejunum up to the ileum, which is the last part of the small intestine. Then we have the cecum and the large intestine. So I'm taking that out now. And there it is. You could see the texture and the size of the large intestine, much larger than the texture of the small intestine. Right here, small intestine, large intestine. And definitely not squeezing that. I could even see the poop in there. Okay, so we have poop. We are not messing with that. All right, so that's that. Now the next part is we're going to take out the kidney. I have an interesting thing to show you about the kidney. There's a lot of fat around the kidney. This cat was definitely well fed. And the kidney needs to have a lot of fat around it for protection. So this is a kidney. That's the fat around it. So I'm going to dissect it out. And I'm going to attempt to show you, as I take out the fat, the ureter coming out of the kidney. And then I'm going to do a sagittal cut of the kidney to show you the renal pyramids inside with the filtration inside the renal pyramids. We won't be able to see that, but you definitely could see the striations. And I really wish you can see. I need to get, there's a special device that puts the iPhone on my neck as like a neck brace, and then you get to see a bird's eye view. So I'm going to do these videos again with a bird's eye view because it's so much better. But in the meantime, this is the best I can do, is I'm going to show you the kidney. There's the kidney. And what am I pulling on? You see that, what I'm pulling on? See how high the kidney is? That's the ureter. Follow it down, follow my finger up and down. Let me separate it out. Here we go. Hold on. Okay, so right there, as I'm moving my finger along it, that is the ureter. There's the kidney. The ureter goes to the bladder. Let me show you the bladder. So I'm going to cut it all out for you. Pretty cool. Okay, I'm dissecting out the bladder, and I'm going to take it out with the kidney and the ureter. Oh, and I found the urethra, so beautiful. It's definitely a female. Okay, I just snipped it. once before I snip out, before I cut the kidney completely out. There's the renal artery and the renal vein coming off of the aorta. There it is, you can see. Let me run my finger through it. Actually, I'm going to probe. There it is. Renal artery, renal vein. There it is. See it in blue? That's the renal vein, and superior to it, renal artery. There it is. Okay, now I'm going to cut it out. I'm going to cut it from the aorta and the inferior vena cava. Wow, how perfect. So there's your ureter. This is your bladder leading out the urethra. All right, there's your kidney. And I was able to pull it out with the renal artery and the renal vein incoming right in here into that hilum. Renal artery, renal vein. And now I'm going to dissect the kidney, take the fat off. I'm probably going to detach the ureter off of the kidney. That's your bladder. So I'm going to detach it now so we could take a look and do a sagittal cut on the kidney. Okay, putting that aside. And nope, everything's been taken out. Let's see. All right. So I'm going to cut this very thick fibrous capsule. I just wanted to show you how thick and strong it is. There's your renal capsule. Boom. See how strong it is? Cutting through the fat. There's your renal artery, renal vein. So I'm going to trim away the fat around it. Okay, cutting more of this capsule. You're going to see more and more of the kidney, the actual kidney. Slippery, so it makes it a little bit challenging. There we go. There we go. Look how nice. That's so satisfactory. So satisfying when you open up, you find a plane, a fascial plane, and in this case it's a tissue plane, connective tissue, which is basically your renal capsule, peeled right off. Kind of like peeling off the inside of a peanut shell. There, look at that. See how it just peels nicely right off? Ta-da! Look at that, just peeling right off. And now that we have the capsule off, I'm going to trim it around that renal artery, which is so nicely visible now, as you can see. Whoops, there we go. Okay, getting off the capsule now, last portion of it. And there it is. Okay. So here you can really nicely see the renal artery and renal vein. So in blue is the vein and in red is the artery. You can see. I'm going to turn it around. It's dyed, so you can see the red is the renal artery and the renal vein. Okay. Now the next thing I'm doing is I'm going to do a sagittal cut. Let me move the cat a little bit. And where'd my blade go? I'm gonna take another one. Okay, here we go. So watch what I do. I'm gonna move some of this junk away. The organs. I should be saying junk. Cat wouldn't appreciate it. Serve the cat well. Okay, so let me see if you can even visualize me as I dissect. I'm going to go further out. There we go. Hopefully now you can see it. I'm going to have to hold it down like this and do a sagittal cut straight through. First, let me make sure I don't cut the artery in the vein. All right, here we go. Straight through. All right, beautiful cut here. Ta-da! And this is a very nice cut. I'm pleased with it. You can see the renal artery and the renal vein incoming. Whoops, hold on. It's so tiny, it's hard to hold. There it is. Okay. Let's see if you can see it better this way. Okay, now I'm going to use a probe to show you and point to everything. Okay, so incoming is the renal artery, which then breaks up into segmental, which then breaks up into interlobar. There's lobes between the pyramids. So I'm going to show you the pyramids are darker in color. So this is a pyramid right here. That's a pyramid. So in between the pyramids are renal columns. So renal artery, segmental, lobar. And then at the end here, I don't know if you could see some little tiny red areas of arterioles, but you've got segmental, interlobar, arcuate, and then cortico-radiate artery. All of that feeds into every single one of these pyramids, which has these afferent arterioles, which feed into a glomerulus, which is a capillary inside, and it's going to be able to filter that blood and get rid of toxins. All right, so I'm going to bring the cat back and pretty much show you that we've taken everything out. And I just wanted to show you the one last part. The rectum is right here. I wasn't going to take that out, but there it is. Okay? All right. So I hope this instructional video was useful. I didn't go over the vessels. It's not that pretty. So we're going to stick with our images, and hopefully this was a good review. All right. I got to touch the phone, so here I go. This is clean. See you next time. Bye.